due to 6 months of persistent diarrhea. She has had 8 to 10 episodes of tea-colored, odorless, watery stools. The symptoms have persisted despite a lactose-free diet and a fasting trial. The patient has had no abdominal pain, fever, or vomiting. Temperature is 36.7 Celsius. Abdominal examination is unremarkable. Sampling of her gastric content shows a total lack of gastric acid secretion. Somatostatin treatment promptly relieves the symptoms.
Okay. Anything which you don't understand in this scenario? Any terminology? Everything is easy? Okay. Yeah. Yeah. 8 to 10 episodes, and that means you have diarrhea 8 to 10 times a day. You're going to the washroom 8 to 10 times a day. Yes. Yes. An excess of which hormone is most likely responsible to these symptoms?
It's serotonin.
Serotonin. Okay. So serotonin does what?
It increases intestinal motility and secretion.
Okay. Good. So serotonin, do you think why this guy would have increased serotonin? It's coming from where? There are other effects of serotonin also. Secretory diarrhea is one, but there are other things which serotonin does. What would happen to the blood vessels because of serotonin?
Dilate.
Dilate. It would also affect the respiratory tract. It should affect the blood vessels in the body. You should have flushing. Serotonin usually comes up when you have excess of serotonin. You would have flushing. You would also have, respiratory problems. And usually, there are serotonin producing tumors in the intestine which can do that. But that would not only have secretory diarrhea, but would have other effects also, like flushing and problems in breathing. So what do you think? This guy doesn't have this. He is not showing you any, symptoms of flushing or, so which other hormones can cause secretory diarrhea? Because this is a secretory diarrhea. Is this a osmotic diarrhea or secretory diarrhea?
Secretory.
Because the type of stools you are looking at, tea-colored, odorless, watery type of stools which you are passing. So if you are passing a lot of material with it, then it is more of an osmotic diarrhea. And what would be the causes of osmotic diarrhea? Like you are not digesting, either carbs or fats. But this is not, osmotic diarrhea. The other thing which you can see is the temperature is normal. So this is not because of infection. Sometimes cholera, Vibrio cholera can affect the intestine and it can cause secretory diarrhea. This is not an infection because the temperature is normal. So this is basically because of a hormone. One is, you have talked about serotonin. What else can cause this? VIP. So the other one which can cause secretory diarrhea is excessive VIP. So this is because of the excessive production of VIP. And one of the tumors which can produce excessive amount of VIP is VIPoma, which is present in pancreas. Sometimes pancreas have a tumor which produces a lot of VIP. Can cause secretory diarrhea. Okay? So explain the mechanism of diarrhea in this case.
Okay, so
Is it training?
at the Krebs cells there is increased release of chlorine in the lumen. So water follows and there's water stools.
Okay. So because of the excessive VIP secretion, you have the exchange of the chloride with bicarb is going to increase. As a result, there is more water following with it. And as a result, you have more of secretory diarrhea. Okay. Why does somatostatin relieve the symptoms in this case? Next group.
Well, next group. Number 9, please.
Somatostatin inhibits the VIP, so you don't have relaxation, and the chlorine
Okay.
exchange.
Okay. So somatostatin actually stops the secretion of all hormones. So it's not only VIP. Gastrin and others are all stopped by somatostatin. So when somatostatin is given, VIP secretion is going to go down and all the symptoms are going to go down. But in this case, you also see that sampling of her gastric content shows total lack of gastric acid secretion. Why is this?
Because the somatostatin inhibits the G cells to
No,
release
that is for relieving the symptoms. But before the symptoms were relieved, this guy would also have secretory diarrhea and low acid secretion in the stomach. Why? The issue is that VIP has a similar structure as secretin. It's a similar type of hormone. It's structurally the same hormone as secretin. So it can bind to the secretin receptors and it can decrease the histamine secretion and decrease the acid production from the stomach. So if you have excessive amount of VIP, it is going to bind to the secretin receptors, going to decrease the acid production. So this is a case of VIPomas. The whole idea here is to look at the hormonal control and look at how the secretory diarrhea is produced.
Okay, can you read the scenario, please?
Next group.
Yeah?
A 13-year-old boy was hospitalized because of acute abdominal pain, melena, vomiting, and difficulty with defecation. Mild abdominal pain was present for the preceding 6 months in the right lower quadrant. There was no chronic diseases nor family history of malignancy. Distended abdomen and decreased bowel sounds were observed during the physical examination. At presentation, melena was present, however blood pressure and other vital signs were normal. Plain radiography indicated a suspicious state of the ileus. Abdominal CT scan confirmed the presence of ileocolic intussusception. We decided to intervene with emergency surgical resection. Finally, he was diagnosed with stage 1 colorectal cancer, and on follow-up a year later, no further disease was found.
Yeah, so one correction here. Usually, patients with intussusception do not present with melena. Melena is usually black stools which are produced when the hemoglobin is mixed with the acid and you produce hemetin, then you produce the melena, which is the black stools. Usually with intussusception you have red jelly type of stools. So when you hear the term red jelly stools, you think about intussusception. And intussusception usually happens in children. Okay, go ahead with the question.
Okay, so describe the normal defecation reflex. So first of all, the feces enters the rectum. This causes relaxation of the internal sphincter and contraction of the external sphincter. And since the external sphincter is voluntary, depending on whether if it stays contracted, the feces there will be retroperistalsis, and the feces will turn to the sigmoid colon. Or if you have relaxation of the voluntary external sphincter, then we will have defecation and relaxation of the puborectalis muscle, which will allow defecation and releasing of feces.
Okay. What are the functions of the colon?
Just next group, please. The functions of the colon are mainly reabsorption of fluids and maybe preparing the body for elimination of waste. Yeah, that's it.
Okay. Only the removal of the waste. What else happens in the colon?
We said the mucus secretion which lubricates feces
Okay.
to prepare it for...
Don't you reabsorb anything from the colon?
Yeah, reabsorption of fluids
Okay. Which
by the
fluids?
feces.
Water and any electrolytes you reabsorb?
Yes.
Which electrolyte do you reabsorb and how do you Okay, go ahead, tell us. What do you reabsorb from the colon?
Your sodium, short chain fatty acid co-transporter works. So you're reabsorbing sodium and short chain fatty acids.
Okay. So if we take the colon out,
Also vitamin K.
if we take the colon out, what would happen? Can you survive without the colon? No.
You can survive. Colon is not essential for life.
Most of the nutrients are going to be absorbed from the small intestine.
What about the water?
Water you can replace the water which you need.
What about vitamins A?
You can supplement them.
Your bile source a little bit from the colon. You're absorbing.
5%, 90% are going to be absorbed from the small intestine.
Unconjugated bilirubin.
So colon is mainly for absorption of water. You have some sodium which is absorbed from the colon, some fatty acids, small fatty acids, but you can remove the colon and you can still survive. So there is
It is not
not
essential for life.
essential for life.
The last question. Yes, let's go. The last question.
Define the
Although
term.
small intestine, if you remove, you cannot survive. If you remove the whole of the small intestine.
Define the term melena and explain its occurrence in this patient. So the term melena is black stool, and it happens mainly because of bleeding in the upper abdomen. While in this patient, we don't have any mention of upper abdomen
So
bleeding.
this patient should not present with melena. In any case, unless he has upper GI bleed also happening, which it shouldn't happen. It's an interception, so we should not expect an upper GI bleed in this. So this patient should present with red jelly type of stools rather than melena. So this is, not right.
What's the name of
It is called red jelly type of stools. Because jelly, you see that jelly, it's sticky. So it's a red jelly type of stools because some of the mucus because there's sloughing of the mucosa, because there is ischemia happening. So sloughing of the mucosa with blood and mucosa and mucus is coming out as a stool. So you would have a red jelly type of stool which is coming out rather than melena. Melena is mainly black stools. Okay.
Last question.
State what is meant by ileocolic intercism.
It's the telescoping of the ileum into the colon. And here it is happening because there is a cancer, there is a tumor. So that's why the weight of the colon is increased and that's why interception is happening. Otherwise, you usually have, it happens with, when you have, these pierce patches in the ileum, if they swell up, that can also cause interception of ileum into the cerebrum.